Hi all, my name is Rachel, and I'm from the Yale University section of Emergency Ultrasound. I wanted to make this video to showcase a new product that isn't mainstream yet, but I think it's pretty cool. Just to put it out there, we have no financial investment in this product. So this is the SonicEye. It's from a company called SonicEye. They invited us to do some testing with this, and we happily agreed. It's a linear probe that you can wear on your finger, and as far as I know, this is the first wearable transducer that I've seen. Here's the casing, and you can put an insert inside to make a snug fit, or if you have a wider finger, you may not even need the insert. You can put it on any finger that you want, and any hand that you want. There's a line here that roughly corresponds to the middle marker of a probe, and here's the footprint on the underside. So let's see how this looks. Here's my fake vein, and I feel like I can anchor myself to someone's skin. I can grip someone's arm circumferentially, and I feel like I can use my other fingers to try to palpate nearby structures or nearby arteries or even the vein itself. So let's try this. There's my needle, and there's my needle tip inserting. I hope you can see this. I'm going to try to do this vanishing target sign, and there's my needle tip as it advanced, and I'm aspirating pretty easily. So let's try a long axis. So here's my long axis, and I again can grip my fake arm here fairly securely. I can also go circumferentially, like if I'm encircling someone's whole arm. And I really feel like this might be an advantage if you have someone who's kind of squirmy or jumpy, because you might be able to latch onto their arm without having or without losing your plane. You do have to be a little bit more careful here because when you're going in plane, you don't want to pierce your finger that's also parallel with your transducer. You also need to make sure that you don't roll your finger, otherwise your transducer is not going to make full contact with the skin and you may lose your plane. So make sure your needle tip is right underneath your finger, but in plane with your transducer. And you can see my needle tip going in and piercing right here. I'm going to aspirate. I'm going to go in and out of plane. So now you can see it shining through. And again, and that was pretty easy. I feel like this is kind of more secure than a standard linear transducer. If I try to do a standard linear transducer, you know, you can still anchor, but it's probably more slippy. And I feel like if someone jumped, then I would probably lose my plane. So all in all, I think this is a pretty novel device that can have implications in both hospital and non-hospital use. Not only in terms of stability, but I think some people like a personal touch when they're having procedures done on them. And having a device like this that allows you to give the patient some tactile reassurance, as well as you being able to grip and palpate other structures or use your free fingers to do something else, I think that can be a real advantage. Like us, I believe there's groups around the country that are investigating this in different settings, including the Army, where having a device that can fit underneath clothing can be really useful. The idea of having a wearable transducer is not necessarily new, but this particular device that increases your proximity to a patient and allows for a tactile sensation while performing both ultrasound and a procedure is one of the most applicable wearable devices that I can think of. Just to mention that they have also developed a biplanar transducer that I'm dying to try out at ACEP, where you can view both the long and the short axes at the same time. So if you're going to ACEP or AIUM, I think these guys go in the list of companies to check out. And be sure to keep a lookout for studies and case reports being submitted about this probe in the near future.